Nursing scope of practice. Influence of nursing practice. The influence that an expanded nursing practice can have on healthcare and the community are limitless. Decreased healthcare costs would be an easily identifiable benefit. Less physician interaction, less cost to the system and the patient. Studies that I will present have shown an increase in patient satisfaction when there has been an increase in patient interaction by the nurse with their role expansion. The studies have also shown that with some expanded nursing roles, there is a decrease in the length of hospital stay for the patient versus interaction with the nurse in a non-expanded role. Additionally, there have been programs instituted that have been able to evaluate, treat, and release patients in a home health care setting with physician consultation as needed, decreasing the need for the patient to be seen within the health system. To understand the nursing scope of practice and potential expansion, we need to know where we are starting. I will review a base understanding of the nursing practice. I will then review some current practices that are identifying healthcare benefits of expanding the nurse practice. In closing, I will identify the value of the expansion of the nursing practice. First, I would like to establish the base of nursing practice. Unfortunately, there is a wide range of nursing practice, even within the U.S., varying state to state. I will focus the basis for this lecture to the Pennsylvania nursing practice. The Pennsylvania scope of practice is written into law known as the Professional Nurse Law. What the PA Nurse Law describes is the general scope of practice for a nurse, and specifically its limitations. It starts by stating that we, as nurses, can treat humans related to actual or potential health problems through services that do not include medical diagnosis or prescribing of medical, therapeutic, or corrective measures, except for a nurse practitioner acting under a physician's order. More simply stated, we cannot diagnose and prescribe. Throughout the world, there has been a concerted effort to look at the risks and benefits of expanding the role of nursing and their interactions with the patients. I've tried to find a few examples that show a positive benefit to expanded nurse roles. A study I found came from Massachusetts General Hospital. The hospital began a program for nurses to have an expansion in their scope of practice. They are titled Attending Registered Nurses. These nurses are assigned to a patient as they arrive in the healthcare system. They follow the patient throughout their stay. These nurses are empowered to promote continuity of care. They are involved with all aspects of the patient's care plan to discharge. Evaluation of this role has shown better clinical performance and a better patient experience. This has also resulted in a shorter length of stay. Another example of an expansion of nursing roles is a specialist trauma nurse. This study was completed in Australia, although it was a review from programs around the world. These roles included nurse practitioners and registered nurses. The nurse's role was expanded with trauma-specific education related to patient care. The roles were also meant to be a more fluent continuation of care for the patient. This allows the nurse to continue their education and expand their scope. The role was identified as being a successful clinical position with significantly shorter hospital length of stays and ICU lengths of stay. Expanding the clinical practice. A study published in the American Journal of Nursing concluded that with the increase in demands from high acuity patients, there is a need for expanded scope of practice for nurses. They tested the theory that nurses could perform lumbar punctures. This task could improve patient access to specialty care and reduce healthcare costs. The study showed that lumbar punctures could be successfully done by an educated nurse. Nursing and COPD. This expanded role was initiated in the UK. The UK has been using nurses to lead COPD clinics in general practice. A large percentage of advanced nurses recommended pharmacological and non-pharmacological interventions. The study showed that patients with acute exacerbations can be safely treated successfully with the support of respiratory nurses. The study also concluded that the care provided by nurses was as safe as the care provided by doctors. Value of expansion. I will conclude with the value of expanding the nursing scope of practice. The expansion of the nursing scope of practice to include directing patient care throughout their treatment has been shown to decrease the length of stay in the hospital. This in turn improves patient satisfaction and decreases the cost of health care provided. Resource management of patients to include higher levels of nursing care decreases the need for physician interaction, promoting more physician availability for other needs and roles. I've discussed the current nursing role as it relates to Pennsylvania. I've presented a few examples of role expansion in nursing. The examples have also identified the benefits of these role expansions. I hope you agree that expanding the nursing role is a benefit to all. Thank you.